So this taxation is one of the important part and thing. So is there any regulations that you said about the poor quality cigarettes for 38 rupees something? Is there anything standard to be for a cigarette?
No.
That can't be. Anything the white and things?
No, the 180 is for two things. Ultimately it's tobacco. Maybe the tobacco quality of the tobacco may not be good, but it's tobacco. So they may be using so-called Virginia white tobacco, etc. They may be using tobacco produced in Mathavy, which is probably lower. But tobacco is tobacco. The main constituent is nicotine.
So, sir, can you tell me about these industrial interferences, especially this?
That is right now the biggest issue that we have.
Alcohol also, you can talk on that.
Both industrial interferences are biggest problem. They interfere at each level. At the ground level, at the top policy level, even at the highest level. And our time we had lots of parliamentarians who were influenced by them. Fortunately, we still have a couple of parliamentarians who are very pro our programs. No, anti-smoke. There are a couple of guys who are really anti. So that's how we are able to maintain the balance. But the company interferes in different ways. One of the problems we have is that our guys go for this thing called CSR. Corporate Social Responsibility, which is basically promotion. So for example, I had a situation where our president in his village somewhere in the...
Dambutegama?
Not this president,
okay.
Previous, this no, I'm not familiar with, only the CCT does that kind of research. I don't do it very much now. Now the previous president who was from Polanaru.
Okay, Mathavy president.
Yeah. He was invited to a agriculture. They fund different agriculture projects. Tree growing, this, fertilizer, all that. So Mathavy citizen was going for this. I was invited. So he told us, Doctor, there's a good program from the tobacco company. He didn't know it was tobacco company, but he told us later. He realized it was tobacco company. I said, so you should never go for any program where when the president goes, then it's like endorsement, man.
It's endorsement.
Endorsement, no.
Yes.
And the company gets strength. They get a lot of mileage out of it. Alcohol, of course, they promote in different ways by having these shows and things like that. Now, say tomorrow, day after, they are having the Royal Tomian match.
Okay. Big matches are starting this season.
On Thursday, tomorrow.
Yeah, Jaffna also we are getting these big matches this week. Yesterday I read a message that this season is for big match season. Please, parents and children, be aware of this introduction of these
schools and
schools. Yeah.
Who has sent the message?
I think from police and things.
Police to ADIC are doing that. Was it official one?
Official.
That's good.
It's a news article.
That's good.
Parents also should be aware where the children are going, what are they using.
Yeah.
Schools also take responsibility for these big matches and things to divert them for other sports, other activities should not be there.
I hope. And it's actually sports is a good alternative for children not to. Yeah.
Yes.
And the other thing is, Dinesh, today, a child smokes starts with a smoke. He may go out of it after 2 or 3 years. Nobody starts smoking as an experiment and continues. 90% of the guys get out, but the 10-15% hardcore they carry on, and that's a percentage that you have in now, which goes. Yeah. You start at 15, 16, by 20, many people have dropped out, or even before that. But people who started at 15 and went on till 20, they are more or less hooked.
Then another issue is 15 and 16 is the one entry. If they are entering, higher chances for continuing for life.
Yeah. So if a person has smoked till 20,
substance abuse. Another thing is
the other things. The smokeless tobacco is one thing, and now of course the hard drugs. And the hard drugs are actually, people who get into hard drugs if you go back to the history of those children, they have started with a cigarette.
Yes.
So smoking is a gateway product for hard drugs. And people don't realize now, they think that two are very separate. They are not separate. To me, they are tobacco, alcohol and ice. It's a progression of the same phenomenon. But we don't treat it like that.
Definitely, we are very hard on these hard drugs, but very soft on this alcohol and smoking.
Tobacco. Yes. That is true. That is true.
So I think definitely we need the governance reforms and surveillance mechanisms. So
definitely.
What advice or nationwide to have a good compliance about this?
Actually, there are two ways. There are. The rules of the game are very simple. We have to attack both the demand side and the supply side. So by these laws and rules and all that, we are trying to reduce partly the supply side, partly the demand side. By education, we are also trying to reduce the demand side. Children not wanting to smoke, etc., etc. So the two have to go very parallel and very seriously. We have counseling service at the NATA. If you want to get some advice on quitting. Now, country like Sri Lanka, you have to help with quitting also because the numbers are small now. The other things are okay, the unit doses continue them, but even a small number are thinking of quitting. We have two telephone numbers at NATA, and anyone can ring anytime until 10 o'clock in the night. We get about, I don't know whether Dinesh you say it's a large number or small number, about 30 calls a day.
That's a good number.
I thought that's a good number. Some people, only 30. I said 30. Then the question is, you get 30 calls, what do we do with that 30?
Yes.
That is where we fall.
That's also my question again. So we are more concentrated on prevention part and controlling. But those who want to quit from these habits, especially smoking and also alcohol, but that sector is, I think, very poor.
More than tobacco, it's alcohol.
Alcohol, yes.
The people who want to quit and need help is more in alcohol. Alcohol does much more social harm.
Much more harm.
Family issues, etc., etc. Also, the harm, physical harm is also serious.
Economical harm.
Economically, socially, family issues. Alcohol is much worse. Yeah, much worse.
So, how we can improve this NATA Act?
NATA Act, we have given some recommendations for amendments. In fact, they are now in the cabinet. The health minister put them to the cabinet, which includes, whether it will go through, I don't know. There are delays, so I have quantified the delays. Taxation. Taxation, not by length. Now, tobacco cigarettes are taxed by length. Short cigarettes, less. Longer cigarettes, but we say it should be taxed for the amount of tobacco.
Not for the length.
Not for the length. Now, there is nothing called, if you smoke a short one, you get less, you get the same nicotine, same product. Sometimes worse.
Maybe the filter is short and more.
No, and also, not only nicotine, there are other noxious elements, no?
Yes.
All these other chemicals, etc. There are no. There are about 3,000 chemicals in a tobacco in a cigarette, which are all harmful, which are all carcinogenic. So nicotine is one thing. Nicotine is one that gives addiction, but the rest of it gives harmful. The cancers and all are due to that.
Okay, one is tax. What else we can propose?
Tax is a very serious thing. Second, of course, is some of these things like tightening some of the rules. Don't allow sale of single cigarettes. We also
age restrictions also think to be strictly adapted.
Now we are 21 now. 21.
Strictly
So
adapting that to thing.
yeah, of course, implementation is always Sri Lanka implementing always a problem. The other thing we propose, and this is also a tough one, is no sale of cigarettes and alcohol within 100 meters of a school. So when I told this to the ministry, one guy looked at me and said, "Doctor, that means Colombo, nowhere can you sell a cigarette or alcohol." Now that's a tough one, no?
Every school, sir, every places we have schools.
There no place, 100 there are some school, there's some school within 100 meters.
Yes.
And then there's a supermarket which is selling alcohol, etc. So it will not work. It will not work in Colombo. I mean, I also think it's a little bit radical to say don't sell that. But in the village areas, that can be done. It can be done. It can be done.
Yeah. And also, sir, your perspective, what's the role of the community public health workers or the other community empowerment groups or the civil societies can play a role for this tobacco and alcohol control?
Actually, civil society groups should play a role in all these things. Even to the extent of, if you take the four main factors, civil society can play a role in each of these. Tobacco, alcohol. Now, other thing, of course, is alcohol. When you talk of alcohol, we have to prevent the people abusing alcohol and using illicit alcohol.
Yes,
Because people say that, in fact, this came up at the parliamentary meeting also. If you increase the taxation and the price of alcohol, that's why that reduce the price.
Yes.
Because they think the argument is Kasipu is going up. Then that's an argument by the alcohol companies. But illicit alcohol is not a health issue. It is a health issue to the extent that there is no difference between illicit alcohol and alcohol as a health issue. The offending product is alcohol. Whether it is illicit or licit, it's the same effect. So that's not the issue. Issue is the illicit alcohol control has to be done by the police. The law has to come in because it's a legal product. If you say it's a legal product, law has to take its course. It is not a matter for the NATA to control. It can't do that. So it may not happen, but now I hear various stories. But the places I know best and where I hear people, the illicit alcohol is a little less in some places. In some places it has gone up.
Because of this demographic transition.
Yeah.
Younger generation is not ready to take for that.
They don't take Kasipu, they don't. It's like the BD. So the social and economic change might have some effect on this.
So, but that's the BD, that's why I worried. I worked with some days in the construction work, young boys, school levels. But they used to the BD now. That's what my worry was there.
Dinesh, actually the BD was used by those construction workers even before.
Yeah. Youngsters also. Generations change.
Construction workers, I don't know what the generation. Construction workers I have never seen in many places. I have not seen them smoking a cigarette.
BDs.
They are basically BD smokers. Now, when you say that young children are smoking BD, that's a phenomenon I am not aware of. I was amazed about a month or two ago near this King's Hospital, which is here, this big hospital. I was going into the hospital to see a patient and I parked the car and I was going. A guy came in a big motorcycle with a young guy, not helmet, with a hair ponytail, helmet also, but ponytail also. And there's a little boutique there. He went there and bought BD. And he lit the BD and he's smoking. Now, that is rare.
Rare case.
That is rare.
I need the surveillance, we need it. I think we need more data. Having engaged with the international health diplomacy and policy dialogues, you have observed diverse models of tobacco and alcohol control across the region.
Yeah.
And some countries have implemented plain packing laws and things. But in your experience from the global best practices, Sri Lanka realistically adapt, particularly responding to cross-border marketing, how we can overcome it, digital advertising and emerging commercial strategies, what can we do for that?
Really speaking, Sri Lanka cannot have cross-border marketing. Because we don't have border. If it is cross-border, it is from one province to another, one district to another. But that doesn't happen.
It's happening, smuggling.
There is a lot of smuggling. I don't say, again, now these are two studies that your university should try to do. One is a good study on the prevalence of Kasipu. Because both MPs from Jaffna said that Dr. a lot of Kasipu in Jaffna. If you can get a handle on that, I've already told the addict guys to do a little work here to get at least more and more information about actual prevalence of Kasipu. Second is the question of BD. Is there a transition now in any way between younger people from cigarette to BD? My hypothesis is no. So you disprove me.
Yeah, we have to surveillance and we need more studies on it. I think definitely I agree.
If you need a little money, we can get a little money.
Sure, I think we have to plan.
From NATA, I can get you some money if you do a few studies like that.
Okay, digital advertising, sir, how can we overcome? Because social media has been
that's a global.
Are you incorporating the NATA Act
No, not yet. No regulations there. But even if you have it in the Act, Dinesh, it's very difficult to implement that. Now, NATA Act also prevents these films.
Just films, just a main.
Films.
We had it.
We have films. During Carlos' time, they said put a mosaic on the thing. But when you
think so, let us.
Yeah, Carlo was promoting mosaic, but mosaic means you miss the film also. So after that, our time we have a warning. Yeah, smoking, and sometimes if it is bad, we used to cut it. Now the other problem is, it's a much simpler problem to solve in local situation. We had a couple of films where a lot of smoking and drinking went on. Recently, there are Sinhalese films. I don't know about Tamil films, but Tamil films from India, so there we can't do anything because they come. But we have a thing called the censor board. Censor board, and now we managed to get a person from the NATA to sit on the censor board. Every Thursday they watch 3, 4, 5 films to see whether they look at other aspects. Our guy is looking at whether there are tobacco and alcohol scenes, and that's why most films now you have cigarette warning. Cigarette smoking is injurious to your health. Alcohol is that comes after all this the censor board intervention. But some films get through. Now it's much less. Now whether that is enough of a deterrent, enough of an education, I don't know.
No, because there are other social media, and Facebook and Instagram things are they are approaching. And also in Sri Lanka, I don't know how much this tobacco companies are targeting women. It's a new market for them, I think. So, is there anything?
Third study for you. Third study. Try to hypothesis is that there is a significant increase in tobacco use among young women. You test it out. You can do it in this, of course. Basically, it's a social class thing, no.
Yes.
The middle class people, not many. The so-called people who go to bars and clubs and all in Colombo, I have seen them smoking, not very much. I have seen them smoking more now than say 10 years ago.
Yes.
I don't think that happens in Jaffna.
We don't know.
You think so?
But
where can they smoke? At home?
We don't know. That's
you know, no? Your generation, your friends, no, I don't think so. My daughter also, my granddaughters, none of them.
My worry is that tobacco companies are targeting women.
Yeah, they are targeting women, definitely, because they have to find at least 50 new recruits every day.
Okay.
Because 50 people die now every day.
Okay.
So, otherwise the number of people smoking will go down. So, they have to recruit 50 people every day.
Target is that.
Yeah. They are paid for that. And they do all kinds of things to do that. But they are not recruiting 50 people because numbers are going down.
So, looking ahead of this next decade and the things already we have discussed with emerging regulatory, ethical and public health challenges, how can the country proactively strengthen its preparedness framework?
Actually, I like to stick to the basics, Dinesh. We have this Empower package. Empower package, if you follow the Empower package, monitoring, P is for promotion. It's a WHO Empower, POWER. There's 6 things that need to do. And they are all contained in the FCTC, including interference by the industry.
Yes.
If we do those 5 properly, the basics, then we are on the correct path. It includes taxation, company interference, advertising and promotion, and monitoring, what we are talking about. So I don't think we need to go into details of that because that's the formula.
So that's also for anything else you want to say, otherwise we can.
No, I want to thank you for coming and listening to me. I didn't prepare for this. So I'm giving you what I remember from different. It's like what you call a dog's breakfast. If you told me these specific things, but since I knew you were coming, I knew you know about this subject at a academic level more than I. So I knew it was easy. So I could just talk and you could fill up the gaps. Yeah, that's good.
Thank you so much, sir, for your valuable time. And
Thank you for coming. It's very nice. Yeah, yeah.
I think definitely we will publish it, and I think definitely it will be helpful for the younger generation, the public health workers who are working in the ground.